Hi, this is Sarah Mikesell with thepigsite.com, and today we're here with Dr. Lisa Becton. She is the Director of Swine Health Research with the National Pork Board. So thanks for being with us today, Lisa.
Thank you very much for the chance to visit with you.
Very good. Now, today let's talk a little bit about SIV and how do diagnostics play a role in a disease complex like that?
Diagnostics play a huge role in our management capabilities for swine influenza virus because it can look like a lot of other diseases, so it's really critical if producers notice pigs with respiratory disease to come in and to get samples and test for that to identify what type it is, and then also to determine what should they do about that. And so we have, with our diagnostics, it really is great because it's a super tool for producers use to, one, identify the disease, then we can tell which type it is, and then we can take the next step of determining, do the current vaccines that are available to producers fit with what they have? And so that's a key component. Another component is surveillance. Because we know back in our experience in 2009, when we had the pandemic H1N1 virus, that really brought a lot of concern to the industry. And so surveillance plays a huge role in being able to help identify what is circulating in the industry, what is circulating on a farm, and then helps determine what is our response to that disease.
Okay, very good. And what can be the I guess the huge benefit to producers? I would think SIV is a huge economic issue, but what are the real benefits for them?
You know, as we look at our surveillance and the use of diagnostics in swine, there's probably three components. One is just to let us understand what's out there. You know, is it different by region? Is it different at all by state? So just what's going on with our herds. The next one is to look at, are our current diagnostics able to detect the viruses that are out there? Because we had a period of time back in 2009 that the pandemic strain of the virus was not as easily detectable. So that's very important for us to make sure that our diagnostic tests can detect what's circulating. And then lastly, really to help us with vaccine usage, because there are several commercial vaccines. However, we do know with some research that not all of them are you know, cross-protective for each other. And so if we know what type and strain that we're identifying, then you can match up the use of either commercial vaccines or potentially autogenous vaccines or farm-specific vaccines to help manage the clinical symptoms of influenza.
Very good. So a producer thinks he has a problem. What should he do?
It's always really good to contact their veterinarian to get samples, to do just a herd survey to see, you know, how sick is the farm or not. And then to submit those samples for testing. We're using a lot of sequencing on the genomic side now to really understand how are these viruses changing over time, because that's also very important, because we want to make sure that if there are changes that we can address that. And there's also a public health component, because we want to make sure that our pigs are, you know, healthy and safe, but we also want to make sure that our workers are safe. And so that's why we still really like to make sure that we're doing surveillance and using diagnostics, you know, on a routine basis to detect what's going on in these herds.
Very good. Well, thank you so much for your time today.
Thank you very much for the invite.
This is Sarah Mikesell with thepigsite.com.